The contents of this presentation are those of the authors and do not necessarily represent the official views of, nor an endorsement by, the Centers for Disease Control and Prevention, the U.S. Department of Health and Human Services, or the U.S. government. Welcome to the Childhood Lead Poisoning Prevention Training. This is Module 1, Foundations of Lead Exposure, and today we're going to focus on the topic of lead as a public health concern. At the top right, there are pictures featuring a father with a young daughter in his lap, a picture of a mother and child at the doctor's office, and classroom with diverse students. In the bottom right is the Centers for Disease Control and Prevention logo, which shows that CDC is a part of the Department of Health and Human Services. The purpose of this segment is to convey the dynamics of lead exposure as a major public health problem and its continuing impact on children and adults. This will help you define childhood lead poisoning, understand its causes, and identify the major short-term and long-term outcomes of exposure. The adverse effects of lead poisoning by blood lead level are many. We use a blood lead level to determine the amount of lead found in a child's body. For most children, lead exposure or even lead poisoning does not have definite symptoms that will alert the clinician or the parent that the child has been exposed to too much lead. We measure lead in units of micrograms per deciliter of whole blood. The effects of lead poisoning vary by blood lead level, and it's a spectrum ranging from very subtle behavioral deficits and intellectual deficits all the way up to encephalopathy and death. Through many decades of research regarding the thresholds of lead toxicity, no safe level of lead exposure has been identified. Currently, the blood lead reference value adopted by the Centers for Disease Control and Prevention in October of 2021 is 3.5 micrograms per deciliter of blood. This value is used to identify children ages 1 to 5 whose blood lead level is higher than most. However, intellectual deficits, including reduced academic performance and challenges in achieving success later in life, may be observed among children with even lower levels of exposure. A graphic showing a test tube of blood marked to show the amount of lead in the blood associated with harmful effects from developmental toxicity at 5 dl to death at 150 dl. Population intelligence can also be impacted through lead exposure. The chart on the left shows a hypothetical example of a large population with a mean IQ of 100. The two tails of the curve represent those with high IQs, greater than 130, and those with lower IQ, less than 70. In this example, about 6 million people would have IQs above 130 and an equivalent number with IQs below 70. A reduction in the mean of 5 IQ points through exposure of lead, 5%, would result in only 2.4 million people with IQs above 130 and 9.4 million people with IQs less than 70, an increase of 57% for developmentally challenged people who will likely require some kind of assistance to get through life. The real tragedy of lead poisoning in the 21st century is that some children are losing the potential to be successful in life. Two graphs comparing expected IQ to IQ decrease by 5 points due to lead exposure. Let's review the differences between the impact of lead exposure on adults compared to children. Children are more susceptible than adults to the effects of lead exposure because a proportionately greater amount of the lead they ingest is absorbed, more circulating lead enters their brains, and their developing nervous system is more vulnerable to lead's toxic effects. The impact of lead on children is on the left. Beginning at bottom left, fetal transfer of lead may happen at very low blood lead levels inside the mother. During each trimester of pregnancy, exposure to lead may affect an infant's neurodevelopment that can have impact later in life. Exposure to lead at low levels below 5 or even 3.5 micrograms per deciliter of blood can cause decreases in IQ, hearing, and growth in children. Lead affects virtually every organ or system in the body, and the mechanisms of lead toxicity involve fundamental biochemical processes, including lead's ability to inhibit or mimic the action of calcium and to interact with proteins. The adverse health effects range from death to impaired cognitive and behavioral development that can have lifelong consequences for children. Lead can also affect cognitive function among adults, as well as contribute to cardiovascular disease, reproductive issues, and gout. Graph comparing children and adults by levels of blood lead toxicity and related effects, which detail the lead concentration from 10 micrograms, for example dental caries, to 150, which is death in children and nephropathy in adults. Lead follows calcium in the body, and fetal calcium needs are very high. If the mother has been exposed to lead as a child or in the last 10 to 15 years, lead deposited in bone is released during pregnancy, crosses the placenta, and into the child's brain. Lead travels from the trabecular and cortical bone into the whole blood, where it goes into the plasma, and from the plasma blood, lead can then be transferred to breast milk and the umbilical cord. The umbilical cord and the placenta are not a barrier to lead. Lead goes freely into the infant's blood and then into its bones. Lead does not cross quite as easily into breast milk. CDC has a document that presents information about lead poisoning in pregnancy and lactation. Diagram showing how lead passes from mother to infant during pregnancy. The key recommendations from Guidelines for the Identification and Management of Lead Exposure in Pregnant and Lactating Women are: first, blood lead testing is not recommended for all pregnant women. However, state and local health departments should identify populations at increased risk to assist obstetricians and other clinicians in targeting women who need blood lead testing. If within your jurisdiction you know that there is a large factory where lead is processed and where women are employed, you should alert clinicians serving the area. If you know that you have recent arrival populations that use a traditional medicine, pottery, or other product containing lead, you should notify the clinical providers involved in treating the new arrivals that blood lead testing is recommended. Testing for lead should be performed if a single risk factor is identified at any point during pregnancy. Risk factors include an occupational exposure, a hobby such as stained glass making, and belonging to an ethnic group where the risk for lead exposure is very high. Another risk associated with lead exposure is a behavior known as pica. It's very unusual, but sometimes during pregnancy, women develop an appetite for things that aren't food. Those women should be tested as well. Both maternal and infant blood lead level test results and environmental findings should be incorporated into both the mother's and infant's medical records in a timely fashion. Women with a BLL that's greater than or equal to 45 micrograms per deciliter should be managed in consultation with a physician who has expertise in chelation therapy. For those very few women who may have a blood lead level greater than or equal to 45 micrograms per deciliter, these cases need to be managed in consultation by a physician who has expertise in chelation therapy. The Agency for Toxic Substances and Disease Registry maintains Pediatric Environmental Health Specialty Units, or PESU, in all 10 federal regions in the United States. The PESUs are a national network of experts in the prevention, diagnosis, management, and treatment of health issues that arise from environmental exposures, from preconception through adolescence. They provide consultation to providers on the chelation process. Some of the chelating agents are teratogens. That means they cause birth defects, especially if they're used in the first trimester. Healthcare providers should consult with these experts before they attempt to conduct chelation treatment themselves. However, it is important to note that the American College of Occupational and Environmental Medicine recommends pregnant women or those who wish to become pregnant should not be exposed to lead that causes blood lead levels to exceed 5 micrograms per deciliter. There's a snapshot of the cover of a CDC report. The cover features pictures of pregnant and lactating women and children. How are children exposed to lead? Lead is found in multiple environmental sources. The little boy in the center of the picture is surrounded by potential lead sources. There's a drawing of a cross-section of a kitchen in a home with arrows showing the various ways lead can get into a house. There's lead in the air that could come from industrial emissions. Widespread demolition of old housing may also result in lead in the air. People can bring home lead on their clothing if they work in lead industries. And there have been many cases of children with high blood lead levels as a result of lead deposited in the car or other vehicles when parents came home from work. The lead dust was on the boots and the clothing and got into the car. There's lead in water. Most of that lead in water is due to leaching of lead into water as it moves through lead pipes. It's very unusual to have lead in the source water, but as it moves through pipes and into the household plumbing, a little bit of lead gets in. There can be lead in food. The most likely source of lead in food is some kind of grinding device or other ways of processing the food, which have resulted in high lead levels. For most children in the United States who have very high blood lead levels, say 10 or 15 micrograms per deciliter, there's likely a lead paint source. As lead paint crumbles and peels, it gets incorporated into the house dust. It also gets incorporated into the lead soil around the house. It gets on toys, it gets on hands, hands get into mouths, and also understand that pets often have lead on their fur, and kids and pets play in just about the same place. There are many, many sources, and if we want to prevent children or we want to intervene for children with blood lead levels of 3.5 micrograms per deciliter, understand that it's very likely that there's more than one source. There is a drawing of a cross-section of a kitchen in a home with arrows showing the various ways lead can get into a house. There are a lot of less common sources of lead in children's environments, and I'm going to share a few of them with you. In 2007, a Halloween toy filled with candy was recalled by the U.S. Consumer Product Safety Commission due to excessive amounts of lead found in the decorative paint on the surface of the toy. About 55,000 units were distributed. Halloween decorations, plastic skull, and candy. Also in that year, a wooden pull-along alphabet and math pull toy was recalled. Surface paints on the toy contained excessive amounts of lead. Wooden pull toy with alphabet and numbers. This baby bracelet or pacifier clip was recalled in 2010. At least one report of a 10-month-old child who was treated for elevated lead levels was recorded by a physician. Baby pacifier clip. These cartoon character fishing poles were also recalled due to lead in the decorative paint. Toy fishing poles. These 3 children's products were not only recalled, but the sellers or manufacturers were subject to a large lawsuit settlement for knowingly manufacturing, importing, or selling products containing toxic levels of lead. Toy jewelry and toy trucks. A charm very much like this was responsible for the death of the last child known to have died from lead poisoning in the United States. It's a dizzying array, and it's difficult to keep track of all of these things. Toy heart-shaped charm. I'm very happy to tell you that internationally, we have achieved the elimination of leaded gasoline for passenger cars. This map shows lead-free gasoline usage worldwide in 2018. As of August of 2021, Algeria, which was the last country to continue using leaded gasoline, was declared lead-free. World map showing progress in lead-free gasoline. This image shows how lead moves from the environment to the brain and how to interrupt this exposure route. Paint, dust chips, lead in soil, and lead from other recreational sources are deposited in soil and house dust. It gets on children's hands, and hands go in mouths. Most children's blood lead levels peak at around age 2, which is associated with the height of hand-to-mouth behavior. In the mouth, it is readily absorbed through the gastrointestinal, or GI, tract. A child who is under age 2 and iron deficient will probably absorb about 50% of the lead that he or she swallows. By the time that child is age 6, he's approaching the adult gastrointestinal absorption level of about 10%. Once lead is in the GI tract, it quickly goes into the system. The GI system can't distinguish between lead and those other metals that you really need, like calcium and iron. If the lead is there, it gets picked up quickly. It moves to the brain. There it affects intellectual development. If we safely remove the lead paint hazards, make sure that the parents or other people working with the lead shower and change their clothes before coming into the house, and if we can limit access to soil by planting trees and grass or putting down wood chips, this will limit the amount of lead that's getting into hands. That's how we could prevent some of the exposure. Housekeeping will help. We like to see the interior dust lead levels below 40 micrograms per square foot. However, sometimes dust is not visible, so even with really good housekeeping, it can be difficult. There are many public health reasons to wash children's hands. Lead is one of them, but realistically, it's hard to keep children's hands clean all the time. Increasing the intake of foods rich in iron and calcium, and also making sure that children have plenty of calories and very healthy diets, will decrease the absorption of lead through the GI tract. When you're working with families in your communities, it's important to encourage qualified families to enroll in WIC. The Special Supplemental Nutrition Program for Women, Infants, and Children provides federal grants to states for supplemental foods, healthcare referrals, and nutrition education for low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, and to infants and children up to age 5 who are found to be at nutritional risk. Sometimes, as a last resort, if the lead in the blood is above 45 micrograms per deciliter, chelation therapies may be required. These are medicines that remove the lead from the blood. Intellectual stimulation is also a good practice for children exposed to lead. An intellectually stimulating environment may be able to compensate for some of the damages caused by lead. Diagram showing how lead moves from the environment to the brain and what can be done to prevent uptake. So where are the lead hazards? Lead hazards are created when lead-painted surfaces deteriorate or are disturbed and the crumbling paint is deposited in house dust and soil. This picture was taken in Rhode Island several years ago, and you can easily see that the paint is not intact and it gets into the soil and is tracked into the house. Many programs are finding that renovation and demolishing old housing is becoming a more common source of lead exposure. This includes commercial buildings as well. When large commercial buildings are taken down, there's an implosion. The lead dust is spread in the neighborhoods, and blood lead levels are likely to increase. In addition, older housing is more likely to have lead water pipes that can leach lead into drinking water. The graph on the right shows characteristics of housing units and the prevalence of lead-based paint. Lead paint is more prevalent in the Northeast and least prevalent in the South. We know that it's least prevalent in newer housing, so we usually use 1950 as a cutoff. Before 1940, we see the prevalence of lead paint is very high, about 85%. It's about 60% in housing that was built before 1960. Residential lead paint was banned in 1978. Between the years 1978 and 2017, lead paint in housing has declined to less than 10%. Compared with rural areas, metropolitan statistical areas, as large cities and their suburbs, have greater lead paint hazards. More lead paint is found in single-family compared to multifamily housing. On the left, we have an image of an older front porch staircase with visible paint peeling from the wood. The right side shows a bar graph comparing the prevalence of lead paint in houses by unit characteristics, including age and geographic location. There are many lead-related occupations and industries, so I'm not going to go through this whole list. But sometimes, when it's difficult to determine the lead risk for a child, and no specific risks are found in the home, questions should be asked regarding where people in the household work, or where people who visit the household work. Lead can be found in automotive repair shops and in motor vehicle parts. Persons conducting home renovation or restoration may be exposed to lead. Occupations that use firearms and lead ammunition may be exposed to lead. Persons employed in or those who frequent indoor firing ranges are exposed to lead. Multiple occupations use various forms of lead. And here are some hobbies that can cause lead exposure. In stained glass, the silvery material between the pieces of glass is made of lead. Pottery and ceramic ware, casting ammunition, fishing weights or lead figurines, making jewelry, hunting and target shooting, and remodeling and renovation of homes built before 1978 can all cause lead exposure. How are we going to protect our children and families from lead exposure? First thing is to learn about foods that help. Foods that are rich in iron and calcium that are not high in fat will help decrease lead absorption. Families referred to a local WIC program will receive culturally relevant training to help moms make sure their children are getting enough of the calcium and iron that they need. Good fats, including soy and almonds, are also good sources of calcium and iron. Here we have an image of a woman and a baby and pictures of foods rich in calcium and iron. Keeping it clean is a good idea. Hand washing certainly helps a lot. Children's hands should be washed before they eat. They should also be washed when they come in from playing outside. An image of a woman and a child washing hands. Putting barriers between children and lead is also a good practice. People coming into the house should leave their shoes outside, which decreases the amount of lead tracked in from the outside. An image of dirty work shoes on a mat outside of a home. Chelation therapy is medication administered by mouth, intravenously, or intramuscularly. It binds with lead so that the lead is excreted either through urine or through the gut. Chelation therapy may be recommended for children with a blood level of 45 micrograms per deciliter or greater, and in adults with high blood levels of lead or symptoms of lead poisoning. Lead toxicity has been recognized for 2,000 years. This is an image from a study that conducted functional magnetic resonance imaging, MRI, on the brains of 150 adults who were exposed to lead in childhood. This is an image of adult brains showing areas affected by lead exposure. Their participants had an average blood lead level exposure of approximately 15 micrograms per deciliter during childhood. In this picture, the red and yellow spots show where participants experienced brain loss. Individuals who experience childhood lead exposure may also experience negative cognitive and behavioral outcomes and loss of brain volume and fine motor function, especially because lead exposure can lead to changes in how the brain develops. Specifically, exposure can lead to physical losses in the prefrontal cortex and anterior cingulate cortex. These areas are responsible for executive functioning, mood regulation, and decision-making. Notably, exposed males had greater losses than females. Here are some of the developmental impacts of lead. No safe level of lead exposure has been established. According to a 2012 report from the National Toxicology Program at the National Institutes of Health, even at low levels of lead exposure, attention deficits and hyperactivity are observed in children and adolescents. In addition, lead exposure was associated with impaired executive functions, including planning and impulse control, visual spatial skills challenges, antisocial and other behavioral concerns, speech and language disorders, and fine and gross motor skill challenges. When a child has lead exposure at the age of 2 years, you may not see any of these developmental impacts. However, by the time the child starts preschool, signs of lead exposure may begin to appear. In preschool, children exposed to lead may not be able to sit quietly for short periods of time and listen and follow directions. In early elementary school, K through 3rd, children exposed to lead may be less likely to reach academic proficiency in reading and mathematics. He or she may have difficulty making the transition from learning to read to reading to learn, and from memorizing arithmetic facts to using math concepts to solve problems. These challenges may continue in upper elementary school, grades 4th and 5th, which may result in continuing difficulty in moving forward in the grade school curriculum. By middle school, grades 6 through 8, they may have difficulty in attaining higher-order cognitive and organizational skills. By high school, grades 9 through 12, children exposed to lead as teens are more likely to smoke, be truant, drop out of high school, commit criminal offenses, or become pregnant as a teenager. There is a snapshot of the cover of a CDC report on educational interventions for children affected by lead. The cover features pictures of young children. How do you implement a childhood lead poisoning prevention program that will help these children and will make sure that they get the kinds of educational supports that can help them? First, lead poisoning prevention programs need to educate parents and school providers. They need to know that lead exposure might not be an apparent problem until a child reaches a level where they're no longer able to function. It's good practice to become familiar with the local Child Find program and develop relationships with local education agencies. Child Find is a national program that was established under the Federal Individuals with Disabilities Education Act, or IDEA. Child Find ensures that each state finds and serves the educational needs of children with disabilities. Under federal law, each state and its public schools must evaluate all children to determine which qualify for special education services. There are Child Find programs in every community. They are supported by the local education agencies. You might consider adding a referral for Child Find to your case management protocol and tracking the enrollment results. Develop a system for contacting families when children turn 3, even if they're no longer in your lead case management system. I understand that it's going to be difficult because children move a lot. But if you enlist the help of the Child Find Agency, other early intervention service providers, and screening and surveillance efforts, the children can be identified through those systems, and their siblings can also be screened. Working in collaboration will enable the Child Find Agency to target outreach and services to children most likely to have blood lead levels above the reference value. Work with the Child Find Agency and inform them where the children in your caseload live. They can do some targeting on their end and can be on the lookout for children that may be more likely to have a developmental issue. How are we going to manage these students that have lead exposure? Each state and public school system must have policies and procedures for finding children who require special education services, and this flowchart will help you think about it. Is there someone in the school who should obtain and review students' records of blood lead level or history of exposure to lead? The school nurse? The principal? Anyone? There should be someone on the school staff who's responsible for looking at the health records and seeing if a child has a blood lead level of 3.5 micrograms per deciliter or higher. Make sure the schools in your jurisdictions are following through on policies for identifying children with special needs. If a child's blood lead level is greater than 3.5 micrograms per deciliter, refer the child to ChildFind. The ChildFind program will test for cognitive or behavioral deficits, and if there are no behavioral deficits, then school-wide academic and behavioral supports should be in place to support academic progress. Most importantly, there needs to be periodic developmental screening for children that have high blood lead levels so that they receive additional education services if they begin having problems transitioning from learning to read to reading. This will help them avoid dropping years below grade level performance before interventions take place. If a deficit is identified, is it a disability? If a disability exists, then there should be a referral for special education. If it isn't a disability, as defined under IDEA, there could still be evidence-based interventions provided such as tutoring to improve reading skills. For children who have attention deficit disorder, behavioral strategies to control some of their impulses could be implemented. Additional comprehensive interventions that match the needs of the child may be implemented by the family or caregivers as well. Continued monitoring is also important. A picture of a girl child at a desk, and on the right a diagram of interventions for lead-exposed children. But really, what we need to do is put primary prevention first, and we need to work with states and territories to ensure that no child in the United States lives in or spends a significant amount of time in homes, buildings, or other environments with lead exposure hazards. A good way to think about this is an objective or a goal for childhood lead poisoning in the 21st century. A goal could be that babies come home to a lead-safe environment. That's the only way we can make sure that no children have any of these problems. One of the ways to do primary prevention includes establishing a memorandum of understanding with the Code Enforcement Department so that you can inspect homes with multiple code violations. In addition, establishing memoranda of understanding with regional Occupational Safety and Health Administration offices may help identify workspaces at risk for take-home lead. The house on the left definitely has lead paint. And as you can see from the bicycle in front, it likely has a child living in it. And lead is probably not the only code violation in this house, so it's very important that you work with the Code Enforcement Department in your jurisdiction to ensure that inspections are thorough and include lead paint and other violations. It's also important to inspect all units and common areas in multiple family dwellings. In the middle picture, you can tell that the windows in the downstairs apartments, this is a 4-unit building, have been replaced. That's because there were children living in those units, and the windows were replaced as part of the remediation. However, none of the windows on the second floor have been replaced. So that indicates that there has not been any remediation on the second floor. But there may be children living there who either have not been tested or have not yet met the threshold for individual intervention in the jurisdiction. Even if there are no children living there now, there probably will be in the future. Bringing all the units and all the common areas into compliance is important, because if there's one case of high blood lead level in the building, there will likely be future cases of high blood lead levels. Data sharing with housing assistance programs is a good practice. The housing voucher programs, which used to be called Section 8, have strict rules for follow-up when a child has a high blood lead level in a property receiving a housing subsidy. Only addresses of properties and the potential hazards, lead paint violations for example, need to be shared with the housing assistance program. That should be sufficient to trigger requirements for mitigation under the Housing and Urban Development Program in your jurisdiction. On the left, a picture of a house with visible damage. In the center, a 2-story house with windows. On the right, a gloved hand holding a toy house. Childhood lead exposure is a problem we can prevent. It's a problem we can solve. I think we're on our way, and I'm delighted to know that all of you will be joining us. Thank you very much. A group of diverse young children is shown. I'd like to acknowledge that this presentation was developed in collaboration with the American Academy of Pediatrics and Dr. Mary Jean Brown, who is on the faculty of the Department of Social and Behavioral Sciences at the Harvard Chan School of Public Health, and is an internationally recognized expert and leader in the field of childhood lead poisoning prevention. The contents of this presentation are those of the author and do not necessarily represent the official view of, nor are they an endorsement by, the Centers for Disease Control and Prevention, the American Academy of Pediatrics, the U.S. Department of Health and Human Services, or the U.S. government. Thank you for viewing Module 1, Segment 1. For questions or comments regarding this segment, please send an email to leadinfo@cdc.gov. Put Training Question Module 1 Segment 1 in the subject line. This will ensure that your question or comment gets to the appropriate person. Thank you very much for your time and attention.